Thank you, Mr Deputy Speaker. When you're sick and you need a doctor, it should not be a Herculean task to get an appointment. However, doctor shortages exacerbate poor health outcomes of everyone, in particular in regional and rural towns. And I can speak for my experience in Mallee. I have two concerns about the recent changes to health policy under the new government. The first is the expansion of the distribution priority areas classification system, as recently announced by the Minister for Health and Aged Care, which outlined the expansion of the DPA to modified Monash 2 areas. As we heard from the member for Dunkley, we now have the international and bonded students, medical students, can go to Frankston instead of Mildura or Oyun or Swan Hill or Horsham, regional areas that are desperate for doctors. Now they can go to Frankston. It doesn't take two guesses to work out where those doctors would prefer to be, where there are lots and lots of patients, lots of other doctors, lots of hospitals who can support them. More needs to be done, and this solution by the now Minister for Health is not a solution at all, and it will detract from the healthcare in our regional and rural areas. The member for Dunkley spoke about a patient who has to wait 5 days for an appointment. I can tell her, and I'll tell this chamber, that in my communities, people are waiting 4 weeks to see a GP. We have older doctors who are retiring, and they need to retire. One of them is my husband. We have very few new doctors coming to our regional areas. This is a huge concern, and this government will now be held to account for the policies they are putting in place. The question I have about the urgent care clinics that this government is putting in place, 50 of them, one in Dunkley. Well, that's excellent. Will there be one in Mallee at all? 83,500 square kilometres. Will there be one? That is my question to the Minister for Health, and it's a reasonable question. A lot of patients prefer to be bulk billed, especially if there are plenty of doctors who are bulk billing. But the bulk billing fees need to increase, and urgent care clinics, great idea, need to be more than a platitude. They need to help us in regional settings.
Authorised by Anne Webster, The Nationals, Mildura.